Greetings, dear learners. In the last class, we finished management of poisoning and also covered the diagnosis of poisoning during post-mortem examination in the dead. We learned the broad guidelines of the management of poisoning, immediate restrictive measures, removal of absorbed poison from the body, removal of unabsorbed poison from the body, administration of antidotes, symptomatic treatment, adequate follow-up, nursing and psychiatric care. Then in the diagnosis of the poisoning in case of dead, we must follow with the clinical history, the post-mortem examination properly, then the laboratory analysis of the viscera, what all to be preserved for the viscera chemical analysis. Then we learned that we may do experiments with that chemical on the animals to know the diagnosis of a poison. Then the circumstantial and the moral evidence about with the accused and the circumstances of the crime of scene. All these may help to diagnose the poisoning in case of the dead. So in this way, finishes the diagnosis and management aspect of the poisoning in living as well as in dead. From today onward, we shall learn the analytical aspects of the toxicology. Under that, we will look at the how to detect the exact poison, exact chemical poison from the different viscera and the different tissues of the body, and how to analyze the samples that we had collected during the post-mortem examination as well as during the living person's examination. So, what is the analytical toxicology? Analytical toxicology is basically the use of the entire range of qualitative and quantitative methods of the chemical, immunochemical, and physical techniques that are used in sample preparation, separation, assay calibration, detection, and identification, and their quantification for the purpose of toxicological testing and the research. So, all the aspects related to the analyzing about the toxin, whether starting from the separation from the tissues, then their qualitative analysis, then their quantitative analysis, and for the both diagnostics purpose as well as for the research purpose involves the analytical toxicology. So the objectives of the analytical toxicology are the determining the levels of exposure of potential toxicants present in the air, water or food that is sent for the analysis, verifying the exposure levels to doses for animals in experimental study. So the effect of the drug on a particular poison, their quantities after a period of time, metabolism and all those things are studied under the toxicology. Analytical toxicology, it includes those of the pharmacological drugs that are tested on the animals, their distribution, looking for their metabolism, all those are covered under this analytical toxicology. Then determining the levels of xenobiotics and their metabolites in the animal studies. So this drugs development, all those are developed with the help of the analytical toxicology. Then screening the blood and urine for the presence of illicit drugs and their metabolites. So the samples that we are sending to the forensic science laboratories or the any analytical toxicology lab that is testing on the blood or urine by the investigating agencies or for the treatment purposes are all analyzed in the toxicology labs. And measuring the level of endogenous compounds and molecules to evaluate the organ function and the damage. That includes all the metabolites that are produced in the body in response to different activities. We may test all the naturally occurring chemicals, endorphins, catecholamines, all those secreted inside the body during the normal to understand the physiology and the pathology of the body. Then identifying the metabolites and macromolecular adjuncts to identify the mechanism of action and what all metabolites, what is the mechanism of the action, where the particular drugs is acting, it is getting, what all metabolic drugs it is getting into. So all those testing and analysis are done under the subject of analytical toxicology. So here we will learn all the methods and all the testing machines and the different procedure that are applied for the analysis of the toxins from the body or any other viscera or for any experiment. So it is important to understand how the analytical toxicology developed over a period of time. Scientific methods of the analysis for the poisons have only recently been developed. Until the 19th century, doctors and the scientists harbored a faulty notion about the effect of poisons on the human body. It was believed that if a dead body was black, blue, or spotted in a places or smelled bad, the cause of death was a poison. Other fallacies ideas were that the heart of the poisoned person could not be destroyed by the fire, and that the body of a person dying from arsenic poisoning would not decay. These were the vague type of ideas prevalent in the society. The first person to suggest a method for the detecting of the poisons in the tissue was the Hermann Boerhaave. He used to place the suspected poison on the red hot coals and smell the odor for the identification of the poison. So here you can see the picture of the Hermann Boerhaave. Basically, knowing about the scientist is very important for the interest of the subject, the effort that a scientist make in a discovery and for the development of the human society is unimaginary. Before coming into the light, a scientist does a very hard work, and out of the lot of experiment, one few of experiment of him gets his recognition and find a useful method or techniques. So learning about the scientist is very important for the development of the science. Science develops only if we understand, we learn the life of a scientist and we realize how much they made the effort and what all the mistakes he made so that a newcomer scientist will not commit the same mistake. So we must have the understanding the life of the scientists and we must explore what all circumstances led to develop the personality and what all difficulties he faced and what all he had done to come to any discovery. So in this way we can develop a better world, better scientific contribution can be made if we are involved into the life of the scientists. So basically, the Hermann Boerhaave was a Dutch botanist, chemist, and a physician of European fame. He is regarded as the founder of the clinical teaching and of the modern academic hospital, as well as he is sometimes referred to as father of physiology, along with a Venetian physician Santario. He introduced the quantitative approach into the medicine along with his pupil Albrecht von Haller and is best known for demonstrating the relationship of symptoms with the lesions. He was first to isolate the chemical urea from the urine. He was the first physician to put the thermometer measurements to the clinical practice. So the medical science that we see today is the hard work of a million of scientists and the scholars. So we must respect them and try to follow the path that had been followed by them. Owing to the widespread use of arsenic as a homicidal poison in the Middle Ages, the first milestone in the chemical isolation and identification of the poison in the body tissues and fluid was centered around the arsenic. So during the Middle Ages, around the 18th centuries, the arsenic was very popular poison. In 1775, Carl Wilhelm Sischle, the famous Swedish chemist, discovered that white arsenic, that is arsenous trioxide, was converted to arsenous acid by the chlorine water, and addition of the metallic zinc reduced the arsenic acid to the arsenine gas. And when this arsenine gas was gently heated, and that led to the deposition of the metallic arsenic on the surface of the cold vessel. In this way, Carl William Sischle was able to recover the arsenic from any of the body fluid or any tissues. Carl Wilhelm Sischle was a chemist and pharmacist who was noted for discovering a large number of chemical substances. He was the person to identify oxygen as the air of fire, the most important element attributed to him. He also helped to discover, isolate, and identify the properties of a long list of chemical elements, including chlorine and arsenic acid. Then in 1821, Sevilla, a scientist, utilized the decomposition of arsine for the detection of small quantities of arsenic in the stomach contents and the urine in poisoning cases. In 1836, James Mars, a British chemist, developed the first reliable method to determine and absorb poison arsenic in body tissues and fluids such as liver, kidney, and blood. This came with an interesting incident. In 1833, James Mars was called as a chemist by the prosecution in a murder trial, wherein a certain John Bodley, the name of the accused, was accused for the poisoning his grandfather with arsenic laced coffee. Mars performed the standard test available at that time by mixing a suspected sample with the hydrogen sulfide and hydrochloric acid. While he was able to detect arsenic as a yellow arsenic trisulfide, when it came to showing it to jury, it had deteriorated, allowing the suspect to be acquitted due to reasonable doubt. Annoyed by this, Mars developed a much better test. So this was the passion of the Mars, that he got annoyed that because his test got failed or could not give justice in the court of law. So he developed a better test for the detection of the arsenic that came to be known as Mars test. He combined a sample containing arsenic with the sulfuric acid and arsenic-free zinc, resulting in the arsine gas. The gas was ignited and it decomposed to pure metallic arsenic, which when passed to the cold surface, and that would appear as a silver black deposits. So sensitive was the test that it could detect as little as 1/50th of the milligram of the arsenic. He first described this test in the Edinburgh Philosophical Journal in 1836. Since then, we have come a long way to the present era of the sophisticated analytical techniques, which can detect even micrograms of virtually any poison in almost any kind of biological specimen. Today, an analytical laboratory has become a vital adjunct to proper management of poison patients. However, it is to be noted that the cornerstone of the management of such poison patients is in the intensive supportive therapy, and that is mostly independent of the kind of the poison that has implicated. It is not necessary to know what kind of poison has caused the symptoms. As I discussed with you, that toxicodromic approach of the management is preferably done in the clinical settings. So we usually will identify the poison with the help of the sign and symptoms only, and we classify them into the different toxidromes and we manage the patient accordingly. there is no need to identify the exact nature or exact poison for the management purposes. So the purpose of the analytical toxicology is not much needed for the management purpose. So where it is required? It is required before the court of law to signify that the particular person has consumed or been given this particular poison. Then for the drug peddlers, drug abuse cases, the identification of the poison at that stage is important. Then in certain cases of the management, we will come to know where the diagnosis of poisons is needed. Otherwise, in most of the cases, the diagnosis or identification of the poison is not necessary for the management purpose only. And hence, routine employment of the expensive analytical techniques should be avoided in general. The attending physician must be judicious in calling for necessary investigations and exercise discretion in the choice of tests to be done. At the time that the IV catheter is inserted, blood samples for the glucose, electrolytes, blood urea nitrogen, CBC, and any other toxicological analysis can be withdrawn. If the patient has an altered mental state, then the attending physician may send blood urine specimen to identify any CNS depressions or drug of abuse or along with the other medications. But the indiscriminate ordering of these tests rarely provides clinically useful information. In the vast majority of the cases, blood tests that are most useful in diagnosing toxicological emergencies are not the toxicological assays but the non-toxicological assays. Routine metabolic profile tests like blood urea nitrogen, glucose, electrolytes, arterial blood gas analysis, venous blood gas analysis that we already talked earlier, that the electrolyte imbalances, the seed-based cell imbalances, all these help to identify the particular toxidromes, and accordingly the management is started. Potential indications for the seeking the help of the toxicology laboratories can be remembered with the mnemonic PROMISE, PROMISE. That is, you must do the laboratory toxicological analysis only in these 7 cases. That is, when there is a prognosis to assess the outcome of a case of the poisoning. Then what the research into the toxicokinetics and mechanism of toxicity. Then order from the court of law or the law enforcement officer. So in general, in Indian context, all the cases of poisoning, the sample from the viscera like gastric lavage or the blood for the toxicological analysis shall be sent to the forensic science laboratories from the casualty or the clinics for the analysis of the toxins. It doesn't matter the case is accidental, suicidal or homicidal. We already talked while dealing with the medical legal aspects of the poisoning. So we have to send the viscera, gastric lavage sample or blood or urine or any other relevant sample for the toxicological analysis irrespective of the case of the poisoning for the purpose of the law. So in Indian context, it is anyway in all the cases of if the living person as well, the toxicological analysis will be done. Again, in case of the post-mortem examination, wherever there is a doubt of the poisoning or in certain indication of the post-mortem where the viscera shall be kept for the toxicological analysis. Then monitoring of treatment measures and their efficacy. There also for the what all benefits, what all excretion or the decrease in the amount of the poison. So basically monitoring of the treatment measures, there also we may need the toxicological analysis. Then identification of the nature of the poison. That identification may help in the investigating agencies always as well, and the even in case of the narcotics or the substance of abuse, it is of importance that the procurement of such drugs may be searched, and then the other for the other purposes and the sometimes unknown poisoning may help to in the researches and the reporting of the cases like that. In those cases, identification of the nature of poison may be necessary. So then the severity to assess the seriousness of a given case. So if for that also we may need then exclusion or confirmation of toxic exposure when in case of doubt, in case of unconscious patient who is coming with unknown reasons, maybe of head trauma or some undefined reason, then in that case also to exclude the toxical exposure, we may need to go for the toxicological analysis. So in this way, this promise condition, we have to go for the toxicological analysis. That is prognosis for the research, then order from the court, then for the monitoring, then identification of the nature of the poison, severity assessment, then exclusion from the toxic exposure. So if the condition or the present patient doesn't come under the 7 criteria, then there is no need for the toxicological and laboratory analysis. Then the Mahoney and associate categorize the treatment of poisoning cases in 4 groups with respect to the toxicological evaluation, where, as we talked, certain poisons may need their identification for the proper management. So he categorized accordingly that if toxicity correlate very well with the serum level and a specific drug therapy may be initiated where the particular antidote is available for that poison particularly. So that is digoxin, ethylene glycol, lithium, methanol, paracetamol, salicylates, theophylline. In those conditions, the serum level correlates with the toxicity and the drug therapy may be given. Here it is very good to go for the toxicological analysis. Then toxicity level closely relate with the serum level, but only a non-specific care is required. Here again we don't have exact antidote and a non-specific care, that is symptomatic management, has to be done. So in those cases it is again of not of much value, but this category of drugs may be barbiturates, ethanol, phenytoin. Then the toxicological testing only serves to confirm the fairly clear-cut clinical parameters of the poisoning. So here only the test only able to confirm the nature of the poison. Otherwise, it doesn't have any benefits for the management purpose. That includes the cyanide, narcotics, organophosphates, tricyclides, because already we by the symptoms we can diagnose them, and just the toxicological analysis help to corroborate the findings. Anyway, the management is already done according to the pharmacological testing and all those other measures. Then toxicity correlates poorly with the serum level and only non-specific care is required. Here the serum level is not of much value and the care is again of non-specific nature. So in this category as well, there is not of much benefit to get the exact toxicological report. That includes amphetamines, benzodiazepines, cocaine, neuroleptics. So most of the poison patients can be treated successfully without any contribution from the laboratory other than the routine clinical and biochemistry and hematology. This is particularly true when there is no doubt about the poison involved and when the results of the quantitative analysis would not significantly affect the therapy. In those cases where an analytical toxicological investigation is deemed beneficial, an orderly progression in the performance of the necessary tests and their interpretation shall be undertaken. So the steps in undertaking an analytical toxicological investigation can be divided into 3 phases. That is the pre-analytical phase, analytical phase, and the post-analytical phase. Pre-analytical phase includes the obtained details of the current admission, including any circumstantial evidence of the poisoning and results of biochemical and hematological investigations. Then obtain the patient's medical history if available, ensure access to appropriate samples. Then we already talked that the biochemical test and the hematological test are more helpful than the toxicological evaluation. As already we talked that for the management of the patients of the poisoning, Non-toxicological analysis is more helpful than the toxicological analysis. In the list of the non-toxicological analysis, some of them we discussed when we were discussing the diagnosis of the poisoning. That includes the acid-base balance, blood sample analysis for electrolyte, blood urea nitrogen, venous blood gas analysis, arterial blood gas analysis, then breath analysis, ECG, EEG, osmolar gap, looking for the osmolar gap, then X-rays in case of the radiopaque substance ingestion. So these all laboratory investigations we already discussed while talking on the diagnosis of the poison. Certain other biochemical tests and hematological tests that may be of help in the diagnosis of the poisoning are blood glucose level, electrolyte, blood gas, and the pH analysis we already talked. Then the plasma enzyme level. Then in hematological tests, the blood clotting, hematocrit analysis, leukocyte count. These all may additionally help. And as we already knew that the biochemical and hematological tests are more of help than the toxicological analysis. So in the blood glucose level, hyperglycemia and hypoglycemia plays an important role in identifying the nature of the poison and the management of the poison. Apart from insulin and other antidiabetic drugs, hypoglycemia is a common feature of poisoning with ethanol, iron salts, paracetamol, and salicylates. Whereas hyperglycemia may be seen less commonly in case of salicylate poisoning. While in case of salbutamol and theophylline overdose, hyperglycemia is the more common features. So in this way, by looking the blood glucose analysis, we can suspect or rule out the particular poisoning. Then electrolyte, blood gas and pH analysis has a very important value in acid-base balance decision and the treatment according to them. The values of these parameters are indicative of the various poisoning. Then the electrolyte, blood gas and the pH analysis that we discussed already, that it is very helpful in diagnosing the nature of the poisoning like metabolic acidosis, alkalosis, hyperkalemia, hypokalemia, all those conditions and different types of poisoning causes. Those conditions were already discussed while discussing on the diagnosis of the poisoning. Then the plasma enzymes also plays an important role, like shock, coma and convulsions are often associated with the non-specific increase in the plasma or serum activities of enzymes such as lactate dehydrogenase, aspartate aminotransferase and alanine aminotransferase. So the poisons that are producing those shock, coma or convulsions may show these increase in these associated levels. In severe cases, there may be the evidence of rhabdomyolysis and disseminated intravascular coagulation manifested by high serum aldolase or creatinine kinase together with myoglobinuria. High serum or plasma potassium, uric acid and phosphate concentrations usually indicate the onset of acute renal failure. The plasma activities of hepatic enzymes are enhanced in poisoning due to carbon tetrachloride, copper salts and paracetamol, the drugs that causes a hepatotoxicity. Chronic alcoholism is often associated with increased gamma glutamyl transferase activity. Depressed cholinesterase activity is useful indicator for the exposure to the organophosphates and the carbamate poisoning. In this way, different plasma enzymes may also suggest the different types of the poisoning activities. Then certain hematological tests of our help are the blood clotting. Prothrombin time and other blood clotting parameters are likely to be increased in acute poisoning of the hepatotoxic agents, rodenticides containing anticoagulants, as well as certain types of snake bites like vasculotoxic snake bite, commonly produced in case of viper. Then hematocrit also has the important value. Acute overdose involving iron salt, NSAIDs and salicylates can cause gastrointestinal bleeding leading to the anemia. So low hemoglobin is indicative of the hemolysis in the body. Anemia may also result from chronic exposure to the heavy metals such as arsenic and the lead. A lowest common cause is the glucose 6-phosphate dehydrogenase deficiency. Then, in case of the drugs like chloramphenicol, chloroquine, nitrofurantoin, primaquine, a person with G6PD deficiency may present with the hemolysis and the anemia. And then the leukocytosis is the recognized feature of the acute metabolic acidosis resulting from ingestion of the poisons such as ethylene glycol and the methanol. It is also seen in the secondary features of the hypostatic pneumonia following prolonged coma. So all these shall be looked upon to make a diagnosis about the poison, and accordingly the management protocol are decided. So the improvement in these parameters will indicate the better management or the correct measurements. So these tests, regular monitoring in the clinical setting, emergency or the wards, help in the manage the patient and evaluate and monitor the patient based on these biochemical and the hematological tests. Then this is the list of the toxic substances that causes hypo and hyperglycemia. There is a large list of the poisons that causes hypoglycemia and hyperglycemia. This is for today. Thank you so much.